final question, which is chapter 13, which is all about next level training and regaining your active lifestyle. Now, we've talked about some of the exercises and, in the core program, and we've talked about the movements of the hip, external and internal rotation, when we talk about restoring the hips. When we talk about regaining an active lifestyle, one of the parts in it, you say divide training into movement patterns, not targeted body parts. Why is training movement patterns over individual muscles so important, and maybe what are some exercises that might show that you're training a movement pattern rather than a body part, if you will?
Yes. Well, it's so interesting that, again, if we use the word corrective exercise, there are some corrective exercises with certain coaches that will not do a darn thing. And there was a failure somewhere to recognize that the person may have a structural flaw or a tightness or an over laxity at a certain joint, and some clinician has decided they're going to do corrective exercise, but they failed to watch the person move throughout daily life. In other words, the person was moving not because of their anatomy or their tightnesses or their laxities. They were moving because of a habit. That's the habitual way they move. So training in patterns helps. It's called creating an engram. You don't use your brain to walk, at least your conscious brain. What you do is you run a tape, a movement tape, and it just takes care of your walking gait quite fine until you stumble, and then you'll have to use your brain again and organize your recovery. But the point is you were running a tape, and that tape is called an engram. People move because of habits and engrams. When you train movements, and we've proven this, by the way, I'm not just talking through my hat. When you train movements, those transfer to the tasks of everyday life. We did a study down in Pensacola on the firefighters. A third of the group were a control group, but 1/3 just did repetitive training for strength and reps. They didn't get coaching on good form and the movement patterns. But the third group were trained in the patterns of movement and how to avoid known injury mechanisms, frontal knee plane motion control, sagittal spine motion, for example. We never showed them how to fight fires, but we measured their movement patterns on the fire ground before and after the training study. Those who just did exercises and trained body parts actually moved more poorly with more injury mechanisms after the study, even though they were stronger. But the ones who were well coached in the movement patterns, that coaching transferred onto tasks on the fire ground. And, I have evidence from different fire departments who have been able to reduce their cost of back injuries by this program of training movements that transfers onto body sparing patterns when they're on the fire ground. So I can give a couple more examples. Let's take a pulling movement, for example. So people need to push, pull, lift, lower, carry objects would be another category of movement patterns, for example. If we can say they have a shear triggered back pain. So, compression is up and down the spine. Shear is 90 degrees to that. Let's say they have a shear laxity and it's a pain trigger. If they bent over and did a row with a barbell, that produces shear on their body. And yet, if we then leant them back and they pulled on a TRX strap, if you know what I mean by that. So they stiffen their body and they pull into with a TRX strap to upright standing after leaning back. That is called a 3-point bending load as far as the spine goes, and there's zero shear. There's no way that they can trigger their pain mechanism. So once again, we train patterns, but choose exercises within those patterns that don't offend their previous pain triggers that you work so hard to desensitize. So now they can get strong again without triggering the pain, and then slowly the tissues gristle and become very robust for load, and eventually you'll go back to bending over and pulling loads and deadlifts and all this kind of stuff. But anyway, we're leaving my book Back Mechanic now and getting into another book I wrote a few years ago called Ultimate Back Fitness and Performance, and that's the one that assumes, okay, they're now out of pain, and now let's train patterns of movement very wisely in logical progressions based on their former pain history. And I think we've got enough evidence in terms of the Olympic careers we've restored, many professional athletes, etc. But anyway, that's a little bit of an overview, I suppose, on that final stage of building a foundation for pain-free activity.
And it's such an interesting subject, because as you were talking there, I was on a course earlier in the year, and there were 2 doctors, and there were about 15 physios on the course. And we were talking about injuries, injury mechanisms, and certain treatment methods. And me being a personal trainer or physical trainer that deals in, I guess, sort of exercise, my perspective was very much sort of restoring movement patterns and, making sure someone was able to lift a weight from the floor or carry a box across a room or something like that. Whereas all the physios and the doctors were talking about is this certain muscle's inhibited, we need to do a stretch or a movement that activates that muscle, and then over a period of weeks when the pain's gone, we can send them on their way. And I just thought it was an interesting how we came from completely different perspectives, because I get the same when they come from like a physio to see me. If they've had back pain, the physio will do certain exercises, and it's then I'm talking about, we want to restore your ability to pick a box up from the floor, we want to restore your ability to push yourself off the floor and things like that. And I just thought, as you were sort of describing it there, that sort of even targeting a certain body part, whereas I was thinking that like bodybuilding training, even from a physio's perspective, they're still targeting a specific muscle rather than can you function properly, if that makes sense.
Well, it's very interesting listening to you now because of this movement by certain physical therapists that just get people to move. All this corrective exercise doesn't work. Well, it probably doesn't work because they're trained in the style that you just described, and they fail to learn from the strength and conditioning community of how to build a robust body, so they start to dismiss it all. It's very problematic, and I think, well, it's a trend, and it will die as people realize the limitations of blaming the patient rather than understanding. Yes, it may require a little bit of tuning of the body initially to create that ability to move well with mobility and stability. But after that, to train the patterns and get it to transfer to real life and make these people very able-bodied again. And again, I'll stand by our record. And I know exactly what it is because we follow up with every person. Of all these people who have been given lifetime compensation for their back, I so disagree with that. Of course, there are some very unfortunate souls who've been terrifically damaged in horrific car accidents and things like that. I get that. But if a person has no trauma, a heavy trauma, I don't think anyone should ever get lifetime compensation. That just usually shows me that they haven't been with a competent person who can take them through the desensitization and then tuning the body, and then getting into your world of adding great ability. Obviously honoring the past compromise that has been in their body, and it may take quite some time for those tissues to really restore their load-bearing ability once again.
Well, thank you ever so much for coming on this podcast today. For me, it's been insightful. I'm sure for the people listening, it's been insightful. And for anyone listening, if you are interested in this subject, if you want to find out more, if you have a bad back and would like it to get better, I cannot recommend the Back Mechanic book. It's The Secrets to a Healthy Spine Your Doctor Isn't Telling You, the step-by-step McGill method to fix your back pain. If you're interested in that book, please go to www.backfitpro.com, and you'll be able to not only find that book, but a lot of other information on that website from Dr. McGill himself. And I guess to close this video, if you have any closing remarks, Stuart, or if you don't, please share them, and we'll sort of finish on that note.
Well, what was going through my mind as you were saying that, we have, again, because of requests of people, they say, could you do a video that would bring the various self-assessment tests and some of the exercise progressions to real life? And so we did that. So if they go on backfitpro.com, they'll see there's a video enhanced version of the book now that they can get. And if they feel as though they need visuals, I have created that. So other than that, Chris, I thank you very much for your initiative in doing all of this.